Hello, and welcome to the Check Rare podcast. My name is Peter Suzuki, and the topic of today's discussion is alpha-mannosidosis, a rare inherited lysosomal storage disorder. This is the second of a four-part series focusing on alpha-mannosidosis, and today we'll be talking to Dr. Reid Sutton on the challenges of diagnosing this rare disease. Dr. Sutton is a clinical geneticist and a clinical biochemical geneticist at Baylor College of Medicine and Texas Children's Hospital in Houston. Hello, Dr. Sutton. Thank you for your time today. To start off, can you introduce yourself and tell us about your work?
I'm Reid Sutton. I'm a medical geneticist and biochemical geneticist at Baylor College of Medicine in Houston, Texas. As my clinical responsibilities, I primarily see patients with skeletal dysplasias and inborn errors of metabolism at Texas Children's Hospital. And of course, for alpha-mannosidosis, those patients have a bit of overlap with both of those two groups. Certainly, alpha-mannosidosis is an inborn error of metabolism. And again, part of the phenotype of most individuals with alpha-mannosidosis, it involves skeletal abnormalities. I initially became interested because I have two patients, siblings with alpha-mannosidosis that I've been caring for many years now. And one of them had significant issues with recurrent synovitis that was challenging to manage. I couldn't find much published on the topic at the time, which was about 15 years or so ago. And so it really kind of got me interested in the immune and inflammatory part of alpha-mannosidosis and the challenges that presents to patients.
What are some of the signs and symptoms of alpha-mannosidosis?
So the signs and symptoms of alpha-mannosidosis, often the way they initially present is with developmental delay. They typically at that time will have facial or other physical characteristics that the specialist is able to recognize. But then over time, again, they often will develop these other issues involving the lungs, heart, musculoskeletal system, immune system that again present challenges for management and require multidisciplinary management.
How is alpha-mannosidosis typically diagnosed?
Right now, there's no newborn screening for alpha-mannosidosis. It's not included in the recommended universal screening pattern in the United States, and I don't know of any other country or location that does newborn screening for alpha-mannosidosis. So often it is quite a diagnostic odyssey for individuals where it's not uncommon for them to see a variety of different subspecialists over a number of years before arriving at a diagnosis. As an example, they often may see, let's say, a neurodevelopmental specialist or neurologist because of developmental delay, otolaryngologist because of recurrent ear infections, maybe an immunologist, again, because of other recurrent infections. And so it often, again, kind of may be quite a diagnostic odyssey in order for them to get a diagnosis. I do think that once they kind of get to a specialist that kind of is incorporating all these, the diagnosis certainly is a bit easier now than it was a number of years ago, in that while it's not included on the newborn screening panel, the first line test for most individuals at this point would be kind of a panel sort of test, or even exome sequencing. And so the testing is now, again, kind of once they get testing, often would be included on kind of whatever that initial genetic test would be.
When do patients typically get diagnosed for this rare disease?
Most individuals, in my experience, are diagnosed in kind of early to mid childhood, again, depending upon the severity of their alpha-mannosidosis. And most typically, kind of the initial concern that I think gets them to a geneticist is developmental delay. But again, usually they will have had these other issues, whether it's umbilical hernia or recurrent ear infections or other sorts of things that have already been ongoing. There are some that are on the more severe end of the spectrum that maybe have a lot of issues with infections that would be diagnosed even earlier. But I would say, again, on average, probably early to kind of mid childhood would be typical for most individuals to get a diagnosis.
Are there any symptoms or cluster of symptoms that may signify to a physician that a patient has this rare disease?
So I think that in general, there's quite a bit of overlap between alpha-mannosidosis and other lysosomal storage diseases. And so it often is not something geneticist or the person kind of sending the testing, it's often not going to be a clinical diagnosis that you're confirming with DNA testing, like maybe some of the other mucopolysaccharidoses or lysosomal storage diseases where we often have a very high suspicion of a specific diagnosis. Alpha-mannosidosis often does not have kind of a clearly recognizable presentation that's going to distinguish it from related disorders.
What other diseases are usually suspected before an alpha-mannosidosis diagnosis is confirmed?
I think most people, when they kind of would see a patient with alpha-mannosidosis, would suspect one of the mucopolysaccharidoses, and probably mostly because those are more quite a bit more common than alpha-mannosidosis, and so kind of people are a lot more familiar with those diagnoses as opposed to alpha-mannosidosis that's quite rare. And in addition, kind of common things are common, and so a slightly different presentation of a common disorder maybe would be more likely than a common presentation of an ultra rare disorder.
What can be done to improve the diagnostic journey of patients?
I think it's really a great challenge in genetics in ensuring that patients kind of get an early diagnosis so that appropriate management can be started as soon as possible. I think that for many rare diseases, there's been a lot of effort to increase awareness, make testing more available, and I do think that those things have helped to some degree, and again, particularly kind of getting included on these large gene panels for lysosomal storage diseases or skeletal dysplasias has certainly helped a lot. And in fact, many of my pediatric orthopedic surgery colleagues here now will send the genetic testing when they see them, so that by the time we see them in clinic a few weeks later, we've kind of got those test results. And so I do think the inclusion on gene panels has helped a lot, and again, kind of making other specialists aware of the availability of testing has helped. But I think for many individuals, there still is often quite a delay from kind of the first time they're seeing a physician for a symptom of alpha-mannosidosis to ultimately getting a diagnosis. I think typically would be, a few years to get there. I think ultimately, including on newborn screening panels, obviously would be the ideal way to ensure that everybody gets an early diagnosis.
What is your discussion like with a newly diagnosed family of this rare disease?
So we go through quite a number of things in the visit, and part of it is a discussion with the parents about the diagnosis and kind of what information that they really want to receive at that moment. So alpha-mannosidosis is a complex multi-system disease. It requires kind of lifelong care, and so there's a lot, right, to try to communicate to parents or patients. And so my approach is to try to understand where they're coming from and what information they need. There are certain parents that are very information seeking, and they're going to want to spend a lot of time discussing kind of what the next steps are over the next few weeks, what does long-term look like, options for research, participation in clinical trials for research and other sorts of things. And then there are other families that are much more focused on kind of the immediate issues, and prefer to really deal with those and put the long-term issues on the back burner. And so again, the conversation, I try to kind of tailor it to kind of what the parents or patients are most interested in. Now, over time, again, those things, all of the things that I've mentioned about, what do we need to do right now, therapeutic options or clinical trials that are available, and then again, kind of long-term prognosis, family recurrence risk, all sorts of things that are kind of going to occur over time as I'm regularly seeing those patients.
What can pediatricians or family physicians do to diagnose rare diseases like alpha-mannosidosis earlier?
I think this is a challenge for many of these rare conditions in how a primary care provider is going to be familiar and recognize a specific disorder. I do think, particularly in children, being very attuned to the attainment of developmental milestones and having a low threshold for referral to a specialist or investigating children that have developmental delays or behavioral issues. And so I think that's the first thing, because it's, again, we do see where an individual has had even from the first year of life delays in attaining various developmental milestones, whether that's gross motor, speech, fine motor, and did not get to a specialist that would have suspected a diagnosis. The other thing I think is just being mindful of, particularly if it's developmental delay in combination with other medical issues. And so again, often in alpha-mannosidosis, things like recurrent ear infections, hearing loss, umbilical hernias, all of those sorts of things, again, should make someone consider referral to a specialist for further diagnostic evaluation.
Thank you for your time today, Dr. Sutton. Do you have any concluding remarks on diagnosing alpha-mannosidosis?
For many of these conditions, making other specialists aware of a kind of a condition is something that should also, like, there might also be an effort there. So, I'd mentioned, earlier, like otolaryngologists, so again, certainly recurrent ear infections are common in children, but, if, the otolaryngologist would, when they're seeing someone with recurrent ear infections, if that individual, also has kind of facial characteristics that are consistent with alpha-mannosidosis, or again, a history of developmental delay, again, kind of having the specialist aware of some of these sorts of other symptoms or medical issues that should raise a red flag that maybe there's more going on than just recurrent ear infections, to get the patient referred or tested early. Or as I'd mentioned, we've worked, because of the skeletal dysplasia clinic, we work very closely again with our pediatric orthopedic surgery colleagues. And as I mentioned, they are aware of testing, they're aware of the treatments available, and they again routinely send genetic testing as they're referring that patient to us. And so I think we've successfully worked with them to increase their awareness of these conditions and the treatments available and the need to start treatments early. And so again, I think similarly for other specialists that are going to be involved often early in the care of individuals with alpha-mannosidosis, making sure that they're aware of, again, of these diagnoses, that there are treatments available, and the testing that's available.
Once again, thank you, Dr. Sutton, for the excellent discussion and your insights into alpha-mannosidosis.